Good afternoon, everybody. Today, we want everyone in Contra, Costa County to know we want them to get a COVID-19 test. We encourage anyone who thinks they need to get a test to come and get one. You don't need to have all of the symptoms to have the test, but we strongly encourage anyone who's just not feeling themselves, who's just not feeling well, to come in and let's get a test. Testing is only by appointment, and you call 844-421-0804, or you can visit cchealth.org/coronavirus to get an appointment. Now this week, the state has opened up state test sites in both Brentwood, Pinole, and Walnut Creek. And this will help us increase our testing. Currently, the county, we are able to now have our own test sites. These are our drive-through sites that are taking place right now in Antioch, Concord, Martinez, Pittsburgh, San Pablo, and newly online in San Ramon. All healthcare providers in the county are working with us to get more and more tests taken. They are offering these tests. For the county tests, there is no upfront charge. We'll take you whether you have insurance or not. If you have insurance, we will run your insurance. But if you don't have insurance, we desperately want you to come in and get tested anyway. Nevertheless, we encourage you to call the number, get an appointment. The appointment line is open every day from 8:30 to 8 a.m. to 3:30 p.m. 7 days a week. And as I mentioned one more time, at 844-421-0804. Come on down and get tested. Thank you.
Thank you, Supervisor Andersen. I am Chris Farnitano, the health officer for Contra Costa County. That's C-H-R-I-S. Last name is F as in Frank, A-R-N-I-T-A-N-O. So I want to make the point that testing is really critical in our fight to control the coronavirus COVID-19 in our community. More testing means that more people know if they have the virus, and they know it sooner, so they can get the care that they need, and they can isolate themselves from others to help prevent the spread of this virus. It also helps us to quickly identify others who may have been exposed by coming in close contact with others who test positive, so that they can also self-quarantine during the period they might develop an infection, and so they can also get tested. We are currently in the process of hiring many new contact tracers to help us quickly identify people who have been exposed and provide them with the information they need to take care of themselves and to prevent further spread. Testing and more widespread testing is really critical to reopening our community. Our ability to test more residents every day helps generate the data we need to determine how and when to lift the social distancing restrictions that are currently in place. Throughout the Bay Area, our local health departments are in agreement that one of the 5 key indicators we need for lifting and loosening the current stay-at-home orders is sufficient community testing. We need to test at least 200 residents for every 100,000 population every day to meet that standard. That's about 2,200 tests a day throughout Contra Costa County. We're currently testing about 500 people every day. So that means we want to test 4 to 5 times as many people as we are testing currently. I also want to point out that this week is National Nurses Week. And so I really want to thank all the nurses that are working at all of our testing sites, as well as all the nurses across the county who are on the front lines every day providing needed care to our residents during this pandemic. I am very proud of their professionalism and their call to duty during this critical time. Now, Contra Costa is going to ease restrictions on the stay-at-home orders as local conditions allow. We did update our stay-at-home order on Monday that allowed more construction and outdoor activities and outdoor businesses, and we put out a series of metrics that we're going to look at to help decide on further loosening. So although the state is going to open up in some areas for some drive-up retail sales, Contra Costa County and much of the rest of the Bay Area will not move to that immediately. We want to stay the course. We want to study the state order, and we want to look at our metrics, look at the effect our recent changes had on our cases and hospital numbers, and look at our progress towards tracking the other metrics before we make any further changes on loosening up the stay-at-home orders. So the bottom line is Contra Costa County does not support a full reopening today, because if we fully reopen today, we know we would have increased spread and many more cases that would go undetected, and there would be many close contacts where we wouldn't be able to identify before they spread infection further. We'd have more sickness, more outbreaks, and more deaths. So we're not ready to get there, but we're taking steps to move towards that place. But now is not the time to let down our guard. The virus has not gone away. It's not gotten any less deadly. There's still a big risk of a surge if we open up too quickly. I do want to really thank all our residents throughout the county, because Contra Costa has done a great job of flattening the curve, and it's because of everyone's doing their part of staying at home, staying 6 feet apart, covering their face, and doing all the other steps to limit the spread of this virus. So the indicators are trending in the right direction, but we still have more work to do to keep these numbers down. We know it's hard to shelter in place. It's hard to follow these restrictions, but it's really important, and I really appreciate everybody's continued patience with these health orders. We wouldn't be asking you to do this if this was not important and if it was not saving lives. Thank you, and I'll take any questions. Yes?
Are there certain areas of Contra Costa County that you are hoping that you get more testing from?
We are really looking at testing individuals who have a lot of contact with the public, so folks who are working on the front lines of healthcare, so healthcare workers, first responders, folks who are working in retail establishments or other essential businesses where there's high contact with the population. We'd like to see a lot of testing there because we know that they are at higher risk. We also want to see a lot of testing in people who work with our vulnerable populations. So our nursing home staff, folks who work in elder care facilities. We'd like to see all of them get tested so that if we can pick up these cases early before they spread to some of our vulnerable residents.
Richmond, Antioch, East County, there are certain cities where there's, up to this point, there's been more positive tests coming in, or as far as, do you want to focus on those to again, keep flattening that curve, to hit the areas where, again, where low-income people are living, where they might be more vulnerable?
Well, if you take a look at our dashboard and you look at the adjustments based on the population, there's not that much variation from city to city. We really are seeing these cases, throughout the county, east, west, north, and south. And so we really want to get everyone throughout the county tested. We know this virus is spreading in every community, and so it's really prioritizing those folks who have more exposure, who are out in the community with more contact with the public.
If there is a positive test result from whoever takes the test, will there be tracing? Will that person be asked to quarantine in a place where they're separate from family members?
Yes, so whenever someone tests positive, those results are sent to our public health department's contact tracing team. They'll reach out to that individual and review the requirements to isolate themselves, and also to identify who are their close contacts and advise those close contacts to quarantine themselves and stay away from the public. If they're not able to safely isolate themselves within their home, if there's other family members, we will try to work with them and try to identify other options for them to isolate so that they're not exposing and continuing to expose other vulnerable members of the population.
Do you expect people to get tested multiple times, and has that already happened? Because what if you feeling symptoms, get tested, and it comes back negative, and then someone sneezes in your direction, you think you may have caught it, you go back and get tested? I mean, how many times would that happen?
We do expect that some people will choose to get tested multiple times. Generally, if you're getting tested because you have symptoms and that test is negative, it's a pretty reliable test that those symptoms are not caused by coronavirus. But again, you may have other exposures, or you may be getting tested because you are in a high-risk area, high-risk line of work, and you choose to get tested over and over again. And so the how often someone gets tested probably depends a little bit on how much risk they're at, and those guidelines are still being developed. But for instance, workers at a nursing home, we're recommending they get tested like once a month, and then because they're working with such a very vulnerable population, those elderly who live in those nursing homes.
Are you concerned that residents will travel to different counties and different modifications?
It is a concern. I mean, the governor's announcement this week about loosening up the state order, in large part, was designed towards rural counties that have less cases and less spread, and their population is much more spread out. So they may be moving quicker at loosening these restrictions than urban counties. But the Bay Area is not an island, and there is traffic back and forth. And so there is some concern that people are traveling to areas where there are looser restrictions and then returning to the Bay Area, and that could be a means of spread. So we really do try to encourage people to not travel unless it's really necessary.
Excuse me, sir, can you speak to businesses at this point, or just strictly health?
Repeat the question, please.
Can you?
Oh,
The question involves, what is the plan for enforcement if a business begins a prohibited activity?
so the question was, what is the plan for enforcement if the businesses begin a prohibited activity? So these stay-at-home orders are legal orders. A violation of the orders are a misdemeanor that can result in either a fine or even imprisonment. But local law enforcement really has mostly been focused on an educational model and really working to educate businesses and individuals about what the order entails. And for the most part, we've really had a lot of cooperation between businesses and individuals on following the orders. We haven't really, local law enforcement hasn't really felt the need to take those more steps, but those steps are available if there's a business that repeatedly fails to comply with the order.
Thank you. And a small follow-up, how has the communication been between businesses and the governors? Are they on the same page and feel it's a very clear line of moving forward and adjustments on the way?
So I think the question is how's the businesses feeling about the steps the governor's taken, and I can't really speak for either the businesses or the governor. I know that we have a call center and we have a FAQ page, and we've really been trying to work through that as well as work with local agencies, local businesses to try to help clarify the order, to help make businesses, help them understand what is entailed in the order and what is required in the order, and we'll continue to work with businesses to help make sure things are clear.
Thank you very much.
All right.
Any last questions? If not, we'll have one last one.
In looking and seeing on the news and how there was recently something on the news where they were showing the nursing home employees getting tested, and if people saw that, they would see, boy, it's painful getting this test. It's not like getting a little blood. You're respond to that? How people might be leery about doing it because
We're actually
of
going to
the
have Supervisor Andersen sit in the chair and get it done.
Uh-huh. Yeah, and I think Supervisor Andersen. I think Supervisor Andersen will maybe tell us later about whether it's painful or not. We're hoping it's uncomfortable, but not. It shouldn't be painful.
Yes, please.
So give him a minute to get a little rearranged. Feel free to come over here, guys, if you want a little more. So give a minute.
Blow my nose
So these
first.
four sweet ladies are standing out here in their PPE roasting. So we thank them.
This is just in case you need it afterwards. Okay? And I'm gonna
Everybody in place? Are we?
have you do
No.
is stay still.
Oh wait, we got one more. Don't do it yet. Hold on.
Oh,
Chris, you want to come over here?
Sure.
Or over there, maybe where she's standing?
No, I got it. Yeah.
All right. Is everybody ready? Because we're doing this one time only. Otherwise, Carl has to do it. All right.
Fine, we'll just keep doing this. We gotta get those PIOs in here.
thanks, Don.
Carl, get Carl in there.
Candace, do you want to say a couple of comments into the microphone?
Yeah.
Yeah, well, hold on.
Right there. It's right there on the table.
I can say it tickles your nose.
Hey,
Just a moment. Okay. I'll wait. Tell me when you're ready.
We're ready.
So what I will say, having never had this procedure before, it tickles your nose. It's an unusual experience, but I would not declare it painful by any means. It is definitely worth coming in and getting this test. It gives us the information we need so we can open back up. So please come and get tested.
Any last questions for Candace? All right.
Okay.
Thank you.
Thank you all.
Thanks.
Thank you. I was the guinea pig. It worked.
She mentioned as far as unusual experience. She said something before that.
She said it tickles her nose.
Yeah, I know.
Yeah.
But after that,
Oh.
something, how it was, unusual experience, something other than unusual experience. Unusual experience.